Hello. So I'm Helen Margetts. I'm Professor of Society and the Internet at the Oxford Internet Institute at the University of Oxford. And I'm Director of the Public Policy Programme at the Alan Turing Institute for Data Science and AI. And I'd like to talk about a stream of research that we're thinking about in the Public Policy Programme. It's joint work with Cosmina Dorobantu, who's Deputy Director of the programme, and Ben MacArthur, who's Professor of Applied Maths at the University of Southampton, and he's Deputy Director of the Turing Health Programme. So we're trying to think about what might data science and AI do for designing policy interventions in times of crisis. How has it performed in the current crisis, and how might it have performed better, and how could we use these technologies to face future crises? Just a word about the Turing Institute and our two programs. So the Institute's organised into 10 research programs, but the two that are leading this research are the Public Policy Programme, which I direct. We were founded a couple of years ago to think about how policy making and government could be improved with data science and AI. And I know that's what lots of people here are thinking about as well. We've got about 25 research projects working with, or we have worked with probably about 70 public sector agencies across all levels of government, trying to think about that question of how data science and AI can help policymakers. And the other programme that's leading this research is the health programme that's directed by Professor Chris Holmes, also at Oxford. And the health programme is working out the same sort of thing in the health sphere. How can you accelerate scientific understanding of human disease with data-driven innovation? And how can you improve healthcare and health outcomes? In the Public Policy Programme, we've spent quite a bit of time thinking about what are the actual things that data science and AI can do to help policymakers. We've kind of narrowed it down to 4. We laid these out in a little article in Nature last year, if anybody's interested to have a look. And those things are, first of all, simulation. How can you simulate policies before they meet the real world and actually avoid the potential unintended consequences of putting untested policies into practice? We have a project, for example, using agent computing, the dominant model for simulation, which looks at developing countries' policy priorities and works out the implications of them putting different levels of resources into different policies and what that would mean for their ability to reach their sustainable development goals, enabling them to kind of optimize their use of resources to meet those goals. Got another project looking at the implications of different levels of resourcing in policing and what that might mean for policing capability. That's led by Dan Burks at Leeds. Then there's a question of measurement and detection. There's all kinds of ways that the government needs to be able to measure things. Could be complex things like poverty, or simple things like how many people have been sick from certain diseases, or how many people have died. It could also be detecting anomalies in the economic system or in the health system that point to some kind of malign behaviour or fraud or something like that, for example. Prediction and forecasting, that's something that traditionally government hasn't been very good at, and there's all sorts of ways that machine learning technologies are being used for that. It could be helping government to predict which schools are going to run into problems or hospitals that have some kind of infection. It could be predicting individuals, predicting risk, for example, predicting those who are vulnerable to the risk of suffering an abusive incident in the home, domestic violence, perhaps, something like that. Or most famously, perhaps, predicting who's going to commit crime or rescind on bail. And finally, the question of ethics and governance. Data science and AI have really highlighted kind of ethical issues in policy making and the way we think, forced us to think about them in new ways. Of course, data science works by using data generated by the existing system to generate insight and predictions. And therefore it exposes ethical issues that maybe we haven't thought about that much before, like how we hire people, for example. Often the ethical issue that is exposed by the technology actually relates to a serious dysfunction in the non-technological system that was being used before. So all those are things which could potentially be really useful in the current crisis. So to what extent are those kind of data science solutions being used? Well, we would argue that COVID-19 has exposed a kind of lack of resilience in UK policy making systems that has actually worked against data science solutions being used. What are they? They're all things we know about, we've known about forever, particularly anybody who works with government or is in government. Lack of real-time data. Government hasn't traditionally been brilliant at having using transactional data from actual systems to help with making decisions. It's much more a culture of kind of official statistics that are collected very carefully in a custom-built way and are kind of produced several weeks after the incident that generated them has happened. There tends to be a shortage of fine-grained data that can cross organisational boundaries. Departments tend not to share data. And there are all other sorts of ways in which policy-making systems, particularly the UK one, tend to be siloed into departments that don't just not share data, they don't share solutions. For example, if a department is trying to identify a vulnerable group, that's a kind of classic problem that data science might be able to help with, they're likely to look at another similar or what they consider to be a similar problem in their own department rather than looking at how that problem's been tackled in another department. So if Bayes wanted to think about which people were vulnerable to fuel poverty, they'd most likely look at some model that had actually looked at firms rather than go to the Department of Work and Pensions, which is consistently looking at how to identify vulnerable people with data. And that's a waste as far as data science goes. We're all very used to the idea that science is specialised, that the multidisciplinary research is difficult, that we tend not to work across disciplinary boundaries. But I think there's all sorts of specialisations within academic disciplines, which we're starting to realise the importance of in this crisis. That in the epidemiological modelling, for example, that was so abundant at the beginning of the crisis, you had highly specialised areas of epidemiology being used to produce insight without really integrating expertise from other parts. And that's how our kind of science has developed in a kind of hyper specialization. And there are ways in which that works against the use of data and integrative models in this crisis. And finally, the way we make policy tends to be done at the political level with very little consideration of implementation, of the kind of data and systems that would be needed to put a policy into action. And that's another issue which has caused sort of caused weaknesses in our capacity to use data in the crisis. All those things lead to a siloed approach, a policy approach. That's almost a kind of truism in a way about governmental systems, but it's really worked out against our capability to make the most of data science. Why is that? Well, here's one example. I mentioned vulnerable groups and how data science is quite good for doing that. There's beginning to be evidence, there was an IFS report in June, for example, that some areas and some people are vulnerable to all three of the kind of risk factors in this crisis: social problems and social isolation from lockdown, from schools being closed, from kind of digital exclusion, reinforcing social exclusion. That's one kind of risk factor. Risk of economic deprivation from unemployment in particular, of course, now that the effects of the crisis are really beginning to be felt. And then the obvious health risk there's all sorts of kind of differential risk, disproportionate risk there for the elderly, really massively disproportionate risk for the elderly. Substantive differential risk for BAME groups, which is exacerbating and highlighting long-running structural inequalities in healthcare and social care. If we could identify people who are vulnerable to all three of those risks, we might be able to intervene in really targeted ways. And that seems to be what is not happening so much, that ability to undertake targeted interventions based on data and modelling. Another way in which the system is working against that is kind of discontinuities and time lags in data flows. The lack of timely death data, we discovered quite early on the crisis that we don't actually have reliable data about how many people have died from a notifiable illness like COVID-19 until about 4 weeks after they've done it. That kind of lack of indicator, of real-time indicator, makes it really difficult to calibrate the policy system. And then there's the lack of spatial data. The lack of data flows from central to local and from local to central. We really saw that in the first of the local lockdowns in Leicester, showing that although it's relatively easy to do blanket interventions, if you don't have that kind of data, it's much more difficult to do local interventions, targeted interventions. And the same applies to sectors. It seemed in the beginning of the crisis and for a long time into the crisis, and really still, that there's a lot of ways in which economic agencies like HMRC and the Treasury are unable to make policy relating to particular sectors because they don't have that kind of data to be able to work out what kinds of companies and build the models to understand what kinds of companies would be affected and should be treated differently. This question of time delays, we know this from, I mean, anybody who's used a shower where the dial takes a long time to feed through to the actual heat of the water knows that that can have very undesirable effects. Instabilities in temperature and you getting scalded. So you don't have to be a biological mathematical modeler to understand that. But if you happen to be, you will know that in complex interconnected natural systems, instabilities can cascade. And I think that's what we are seeing when we don't have the capacity, we don't have the timely access to relevant data like the death data I mentioned, and the structure needed to respond appropriately to help stop those cascades. Another thing we need, but have tended not to be able to do, is kind of what I'm calling solid, unromantically solid modelling. Interventions require solid modelling. They require models that can be resilient to surprises, and that's one thing we haven't seen. A lot of economic models, for example, in commodities markets, for example, just couldn't work with negative oil prices. It was just not something that had ever been thought about or built into them. We need integrative models that focus on the epidemiology and the economy, for example, on education and health, on the economy, on the economy, education and health, and so on. We've tended to see modelling focusing on one aspect of the crisis, but not multiple aspects of the crisis. We've had a kind of lack of evidence-based interventions, and that's partly, it seems, because of our inability to do cross-country learning. When it comes to opening schools, for example, how much are we really learning? Journalists seem to be learning, but are policymakers learning from all the experience of other countries where schools have been opened or kept closed or opened in certain ways? There's real possibilities there, but our policy system doesn't seem to be very responsive to that kind of learning. And finally, what about all the natural experiments from services moving online in this kind of massive forced innovation? Take primary care. Primary care was a bit like universities. We've been talking about moving to online learning for 20 years, but we didn't really actually mean to like do it completely. But that's what's happened here. Huge tranches of sectors have kind of moved online in a hurry. And they really need to be learning from that with a kind of modeling of natural experiments to understand, because it is a kind of natural experiment, to understand the implications of that, to understand what aspects of that we should keep and what aspects we should mitigate and overcome the kind of pathologies of it. We need to build interconnected responsibilities. Again, turning to natural systems. Anything that's interconnected is predisposed to cascades of failure. And of course, the virus is the ultimate interconnected phenomenon. And if response systems aren't interconnected, if they're kind of siloed, if they don't match the interconnected nature of the world or the virus, then that's definitely a problem. The same kind of propensity to cascades of failure. And all that points to ability to do this kind of integrative model and connecting knowledge domains between these kind of hyper specializations, for example, to transfer information between response structures. Transfer learning, a variant of machine learning, which uses models that have been developed in one system to kind of learn things and feed them into another system, might be one way to around that, and perhaps we need to be prioritizing that kind of technology. So all those weaknesses that the virus has exposed in policymaking systems and the kind of things that might be done to overcome those weaknesses and build resilience with data science back into policymaking systems are the kind of things we're thinking about with this for this stream of research, which is called Shocks and Resilience. So just to summarize, what are they? Integrative models which bring together data and models from the health system, from the economy, from the education system, from benefits delivery, from the actual service delivery systems, which are generating so much transactional data in this crisis. Our policymaking systems needs to get much better at using that kind of data. We need to confront trade-offs. Of course, policymakers don't like confronting trade-offs. It's not politically desirable at all to confront the trade-off between economic recovery and saving lives. But we do need to think about how we can build models that do confront those kind of trade-offs, because they are implicitly being made. We need to intervene for vulnerability. Vulnerability works against resilience. Inequality works against resilience. So we need to identify and intervene all the vulnerabilities and inequalities that are being thrown up in this crisis. That ultimately could make our policy systems better than they've been for decades, but it is something that really needs attention. We need to quantify uncertainty. A lot of the models we use were built in conditions of very low uncertainty, but this is a condition of massively high uncertainty with a new disease and an unprecedented this and unprecedented that, an unprecedented use of the word unprecedented. And most of all, we need targeted interventions. We know that now. We need to be able to make local interventions, interventions for particular sectors, interventions for vulnerable groups. All those things could really be helped with good data and data science that brings in knowledge and information from different sectors and areas. Let's make it do so. All of that, though, just to finish, potentially means a sort of shift in the way that we think about data science, and particularly artificial intelligence. Huge resources and kind of innovation and technological brilliance goes into getting artificial intelligence to build things which do things which humans can do already, like, I don't know, walk without falling over, or play Go, or drive cars. And I'm not saying we shouldn't do that. I'm just saying that as well, we need, and perhaps we need to prioritize at this moment more than any, the use of data science and AI to do what humans can't do, which is to connect areas of knowledge, to integrate multiple large-scale data sources and take the insights from all of them into account at the same time when making decisions. That's not such a glamorous task as robots, all singing, all dancing robots, but it is perhaps what we need at the moment. It's actually very difficult. All those things that I've listed there are really, really difficult. So really it's a case of, it's not rocket science, it's much more difficult. But before I finish, I should say one other thing, that in all of this, we mustn't forget the kind of ethical frameworks that we're all developing for the use of data science and AI in government. I'm very proud of the fact that at the Turing, in the big de-COVID project, which is using real-time health analytics data to try and develop our understanding of this new disease, that our ethics lead, David Leslie, who's talking at this conference, was actually delivering ethics sessions to data scientists and clinicians. It's not necessary. There's a lot of data governance rules that have been sort of thrown away in the heat of the crisis, and we must make sure that that's not a permanent thing, and we must build those into all of our policy interventions and responses. Thank you.